President.
Senator from Oregon.
The Senate tonight voted to turn its attention to this issue of opioid addiction. And clearly, what we know now is that opioid addiction has carved a path of destruction across America, a path of destruction from Medford, Oregon, to Manchester, New Hampshire. And during a number of community forums I held just a few days ago across my state, we talked about how we're going to grapple with this great challenge and what it's going to take to really turn the problem around. My home state has the dubious distinction of ranking fourth worst for abuse and misuse of opioids in America. In my state, citizens made it really clear they are not going to accept being fourth worst. And I know from talking with many of my colleagues that a whole host of states are dealing with this challenge. And what I have been struck by, Mr. President, is how opioid addiction keeps manifesting itself in ways that we certainly wouldn't have known about even 10 or 15 years ago. I was particularly struck with the parents who told me at home in Oregon about high school athletes struggling with addiction to opioids. When I played basketball, dreaming of playing in the NBA, there was never any talk in the locker room about opioids. Now the next generation of young athletes seems to be getting caught up in this. They have an injury. Young people get down when they're not able to play sports. They get depressed. Maybe they go to a party. Maybe it starts with some alcohol. Maybe it starts with a prescription, but all of a sudden it mushrooms and grows. And this is what parents were telling me at home, and it's clear that the Congress cannot sit on the sidelines while the opioid addiction problem continues to mushroom. In the coming years, Medicare and Medicaid are expected to account for over a third of substance abuse-related spending. So we are talking, Mr. President, about billions and billions of dollars each year. As the ranking member of the Senate Finance Committee, which is required to pay for these bedrock health programs, I want to talk just for a little bit tonight about the critical role that these programs are going to play in stemming the tide of opioid abuse. And I'd like to begin by saying that it's my view that the American people are paying for a distorted set of priorities. Our people are getting hooked on opioids. There's not enough treatment, and vigorous enforcement is falling short. That, in my view, is a trifecta of misplaced priorities. And the Congress, beginning this week, and it's not all going to be done this week, has the opportunity to develop fresh policies that will begin to right the ship. Last week, the Senate Finance Committee held a hearing to discuss the opioid crisis. And as I listened to the debate, there was a sense that policymakers are really sort of lined up to choose between two sides. One is tough enforcement, which means cracking down on pill mills, fraudsters bilking Medicare and Medicaid with unneeded prescriptions, and unscrupulous abusers who doctor shop for their next bottle of pills. Then there's another side that believes that there should be more focus on social services. My own view is what's needed is a better approach that includes three priorities: more prevention, better treatment, and yes, tougher enforcement. And true success, Mr. President, is going to require that all three work in tandem. When it comes to preventing addiction, any discussion has to include how these drugs are prescribed in the first place. And I have come to feel, Mr. President, as I got around Oregon and I listened to the testimony in the committee, Finance Committee here recently, what has happened is America for the last 15 or so years has been on a prescription pendulum, where doctors were once criticized for not treating pain aggressively enough. Today, they seem to be criticized for prescribing too many opioids to manage pain. So our challenge, in my view, is to work on a bipartisan basis to get this balance right. Of course, we want our people to have an opportunity for science-based pain management. And we also don't want the indiscriminate prescribing of opioids. It's about getting the balance right with respect to this prescription pendulum that our country has been on for the last 15 or 20 years. And I'm pleased that the Centers for Disease Control and Prevention is breaking some new ground with their guidelines for prescribing opioids. And if successful, I believe they could provide a meaningful reduction in overprescribing. I've also been concerned about the influence opioid manufacturers have on prescribing practices. So I have sent, as the ranking Democrat on the Finance Committee, an inquiry to Secretary Burwell to ensure that any potential conflicts of interest have been properly disclosed for members of government panels who are evaluating the Centers for Disease Control guidelines as a result of funding they receive from drug manufacturers. Our physicians ought to have the best information on prescribing these powerful drugs without undue influence from the companies that are manufacturing them. Now, in my view, a key piece of solving the opioid addiction puzzle has got to be prompt and effective treatment of those who are dealing with an addiction to opioids. The Finance Committee, Mr. President, had 3 witnesses last week. A witness that was chosen by our distinguished chairman, Senator Hatch, a witness that I chose, and an expert who was well thought of by all sides. And the question really was, how do you solve this opioid addiction challenge if you just restrict access to opioids? I personally believe that that kind of enforcement regime should be part of a solution, and I support that. But if all you do is restrict access to opioids, each of these experts, Mr. President, the one chosen by Chairman Hatch, the one I chose, the independent expert, all of them said if all you do is restrict access to opioids, the addiction does not go away. The addiction doesn't just magically disappear. And I really hope that we can emphasize this as the Senate begins our debate. Any lasting solution is going to have enforcement, which this bill focuses on, but it's also going to have treatment and prevention. And we're going to have to improve access to addiction treatment and mental health services. And I know the distinguished president of the Senate, like my state, has a lot of rural communities. And it's going to be particularly important to ensure that they're served. And I think the distinguished president of the Senate knows it's not a surprise that some of the rural communities have some of the highest rates of abuse and opiate overdose in the country. Mental health and treatment for addiction has certainly gotten short shrift for too long. And it's too important to have that kind of policy, and it's high time for a change. For example, Congress ought to also be taking a look at what's called the IMD exclusion, an out-of-date policy from the 1960s that says services like rehab or some emergency mental health stays in an inpatient setting, can't be covered by Medicaid. That is a big policy change. I think it's important that we debate it, and I think we all understand finding the vast sums needed for those services would be a unique challenge. Mr. President, at the end of the day, this, like so many other important issues, requires that our Congress make some tough choices. Yet if prevention and treatment are not locked in up front, we ought to realize that if those are our choices, to not give adequate emphasis to prevention and treatment, the overall bill is going to come in even higher. Pregnant mothers giving birth to opioid-dependent babies. EMTs in emergency rooms dealing with overdose calls every night. County jails taking the place of needed substance abuse treatment. Able-bodied adults in the streets instead of working in the private sector at a family wage job. America's tax dollars ought to be spent more wisely. So as we begin this debate, about tackling the opioid scourge that has carved a path of destruction from one end of the country to another, the Senate has got to find the right mix between prevention and treatment and enforcement. It's going to be that kind of strategy, Mr. President, a fresh strategy where prevention, treatment, and enforcement work in tandem, that's going to make a real difference for our families and our communities struggling to heal. I hope those who may have followed this speech will recognize that I haven't talked about Democrats and Republicans here. I've been talking about a set of approaches that we can all work on together. And in fact, all three of the witnesses, all three that were before the Finance Committee, made it clear that you had to have those three approaches, prevention, treatment, and enforcement, work in tandem if you wanted to solve the problem. So I think it's important Democrats and Republicans recognize what those experts and others have said is going to be necessary to help our families and communities across this country heal. We can do it in a bipartisan fashion, Mr. President, and I'm committed to working in just that manner. Mr. President, with that, I yield the floor, and I would note the absence of a quorum.